It's just dinner. Relax. What could he possibly do?
Sorry we're late. This is Sarah.
It's nice to meet you.
His muscle biopsy's clean. It's not trichinosis.
Fungal infection.
You want to retest every sample we took for spores? We'll be here all night.
He's not going to accept this isn't environmental unless we give him no choice.
I cannot believe you're from Bloomington. Remember that strip club?
Girl, I used to work at that strip club.
Of course, House is messing around with escorts when the Grim Reaper looks to be escorting our patient out of the building. Very excited to be reacting to House MD Season 6, Episode 18, Nightfall. On this channel, we are reacting to all 177 House episodes, and this will be episode 129. Let's see if I can get the diagnosis before House does as a doctor working in London.
Today, your queen will choose her champion, but only if he can defeat Sir Horace the Black.
Sir William, what's that fight for my honor?
To the death, Your Majesty.
I choose Sir William as my champion.
The captain of my guard, Sir Horace the Black. Brave knight, have at ye!
William? What is it? Your eyes.
We need an ambulance at the Camden Fairgrounds.
I mean, he did say you'd have to fight to the death, but he expected that to come from Horace the Black, not I the Red. I've reacted to too many of these now. Alright, well, we know our Queen's champion had a few blows to the head and now felt dizzy with bloodshot eyes on both sides. The obvious thing here would be a brain bleed, but that wouldn't really present with red eyes, and the man, come to think of it, even stopped blinking. Maybe he was surprised to see a phone in medieval England. That'd do it. The lack of blinking in that case makes me think this is more of an absent seizure type situation. Oh, okay, I have a theory. The medieval cosplay and knight's armor is created using medieval methods, meaning that they're coated with lead. That could cause irritation to the eyes because of the heavy metal exposure, and we know lead poisoning can cause seizures as well. This may be either the first time he's had the armor on or the first time he's reacted because he's just reached the toxic threshold, which is why it just started now. Oh, that would fit the story and the symptoms so well and would be pretty difficult to diagnose. All right, I'm going for lead poisoning for my first diagnostic guess because that would be a wild call. Let's get more clues.
You're new.
You're naked. And I was just bleeding.
Without breakfast?
I'm Sam, by the way. Put this on.
What the hell?
Huzzah, my loyal peasants. Check out the knight down in the ER, who instead of seizing the throne, just seized.
It says here he's been camping out for a month.
Try doing that with a pen. 2 demon eyes hemorrhaging in the sclerae. Foremen take Frodo and break bread with the hobbits. Who's the chick? Why are you hiding her? I was thinking, why the hell were you naked in the kitchen? Samantha, the soulless harpy you were married to before we met.
People change.
Fine, I get it. It's your life. You go screw it up.
Brian looks completely normal. Normal except for the fact that he likes to play dress up.
I'm not pretending.
You don't really think you're a knight, do you?
Uphold ideals like loyalty, courage, humility.
Okay, that might just be one of the most badass references in House. He sliced the head in two with the sword, and then he says, you can't do that with a pen. So subtle, but so beautiful. Clearly referencing the quote, beneath the rule of men entirely great, the pen is mightier than the sword. That's from Edward Bulwer-Lytton that stretches back to the mid-1800s. It appeared in one of his plays and just a year later it was in common use. Imagine having a line you wrote 200 years ago that still exists, and clearly it's gonna last some more. It also explains why it's so important to find the right balance between free speech and hate speech. Our patient may not be speaking for much longer though if we don't find out what's wrong with him, and it seems like he's convinced he's a knight. It isn't so clear this is a delusion though, as he seems pretty with it, and he says he is a knight since he holds the values of one. Now, if he thought that he was an actual medieval knight, then that would be a totally different story. It also seems like House has figured out that Wilson is playing the white knight again, as he's back with his newly single ex-wife. And House isn't happy about it. Either way, I need to find out if my lead poisoning diagnosis is right. Let's get more clues.
Are we almost done?
Anything abnormal on the MRI?
What strange manner of garments be these?
Do I look like I'm here to play pretend with you? Our knight just vomited inside the MRI. Child thinks it might be food poisoning.
We need to look at the area he was camping out in.
Things like vomit.
Like this. It's a cow eye.
He makes the knights eat all kinds of disgusting stuff.
I make them all take an oath of secrecy about the ritual.
No one else was sick because they weren't allergic like he was. Run scratch tests. Treat him with epinephrine, too.
That, feels strange.
Tachycardia. Need to shock him back into rhythm. What is this? It's definitely not an allergy.
Unless he's allergic and allergic to the cure.
There is an infection that can cause skin and neurological damage and spreads rapidly without treatment.
Marcia.
Foreman was having absolutely none of their cosplay. If there were an embodiment of the words no chill, he would be it. Now the team think the patient has MRSA because Foreman touched him without gloves when he went to check his pulse during the fast heart rate. Clearly somebody wasn't paying attention during their infection control training. Now they think that it's causing the rash, but there's absolutely zero chance of that being the case since bacterial infections take at least a few hours after exposure as an incubation period. That's when our microscopic, not so friendly friends decide to use our body as a petri dish and reproduce rapidly. They then hit a critical mass of numbers that causes disease, and that doesn't happen within 15 seconds like the team is wondering here. So what else could this be? Well, we know his heart rate went fast after the adrenaline and when 13's needle touched him. We also know that he started getting these red spots on his body that came up suddenly. I mean, it does sound like an allergy, and House mentioned he could be allergic to adrenaline, which would be such an ironic House-like diagnosis. Allergic to the treatment for allergy. But can you be allergic to adrenaline though? Well, not really, because it's a natural hormone that's produced within the body. What you can be allergic to though are the sulfide preservatives that are in an EpiPen. I mean, that would work perfectly here, but it still wouldn't explain the original allergy he had and why his eyes are still red. If that is allergy related, then whatever triggered it would still be in the room or in his body. Whoa, wait a minute, I have a theory. Earlier on, 13 was mentioning all the things they made the knights eat as part of their initiations. One of the things was cow brain alongside the cow eye and pig rectum with a side order of sphincter. What if the seizures were caused by eating the cow brain? Ever heard of mad cow disease? Well, that's exactly how it can be transmitted. A prion disease called Creutzfeldt-Jakob or CJD. Exposure to contaminated neural tissue then causes this damaging protein to be absorbed into the body where it translocates into our brain and spinal cord. This can cause seizures, visual disturbances, a lack of coordination, psychological symptoms like confusion and agitation as well. It's even possible it could make you eat the dogs, eat the cats, eat the pets.
They're eating the dogs. They're eating the cats. They're eating the pets.
As well. Sadly, there would be no cure for the CJD, but I mean, it fits here so well, especially alongside the unreasonable dedication to the knighthood thing. All right, I'm going for CJD via cow brain consumption as my second diagnostic guess. Let's get more clues.
You get the knight into isolation on an IV antibiotics.
He doesn't seem to be in as much pain anymore.
Pain in my chest, it's getting worse. I didn't want to worry her.
So how long have you been in love with her?
No, we're just friends. Since the first time I saw her. What kind of knight steals his friend's bride?
You're just a guy.
But I want to be more than that. My back feels like there's a knife in it. Is the infection spreading?
It looks like some sort of clostridial organism. It's not MRSA.
I know. It's poison ivy. They have bonfires every night. Burning leaves aerosolizes the oil.
It's his heart rate again, blowing.
Giving him 12 cc's epinephrine.
He tested positive.
That wasn't caused by poison ivy.
Or epinephrine.
What? This guy tested positive for adrenaline allergy, his heart starts to slow down, and they give it to him anyway, and then he's absolutely fine. If this happened in the real world, then there'd be 1200 cc's of paperwork to fill out afterwards from all the investigations. Speaking of paperwork, I saved a restaurant from having to do quite a lot of it the other day. I was sat in the restaurant having a date with my wife, and someone shouts, "Help!" I stand up to see what's going on, and there's a lady with her hands on her throat. She's not breathing, her lips are turning blue. People aren't sure what to do, so they try to do the Heimlich maneuver, but were unsuccessful. So I had to try and help. So I run across, get behind her, put one fist just under the ribs and an open hand under it, pushing upwards to try and squeeze the chest and pop it out. One attempt, not moving. 2 attempts, still not. 3 attempts, and she starts falling to the ground. Her lips are turning more blue, but as she goes down, the piece of steak comes out. It was blocking her airway. I put her in the recovery position and she was fine, recovered fully within a couple of minutes. Now, doing this was a reward in itself, and this isn't a sponsored video, but it was quite nice of the restaurant Miller & Carter to give me a full refund on the bill as well, since I wasn't expecting it. So if anyone's in the UK, definitely check them out, but just make sure to properly chew your steak first. So why was the AP injection a bad idea? Well, besides the allergy, it's much safer to give something called atropine to raise the heart rate, as it's less likely to push someone into a rebound abnormal rhythm. In fact, we really just use adrenaline injections for about 4 things: allergies, cardiac arrest when the heart has literally stopped beating, in local anesthetic to help it stay around the area for longer, or to stop bleeding in sensitive places like the tonsil. We do have some interesting new clues here though. The heart is getting slower, he has chest pain, there's poisoned ivy being burned in the bonfire, and he has a Clostridium bacteria on the skin. What in Middle Earth is going on? Firstly, the poison ivy exposure doesn't really fit, as that would likely cause a rash with irritation of the nasal cavity and respiratory passageways fairly quickly. For him, the rash started while he'd already been in hospital for a few days, so that rules that out. If they were burning ivy though, then they could have been burning something else that's also causing his symptoms. But then what about this Clostridium bacteria on his skin? In all fairness, there are a ton of different types, but the one that usually causes skin infections is called Clostridium perfringens. It's not exceptionally common, but it's likely contracted from meat, chicken, and food cooked in big batches and then held at unsafe temperatures. If it is that, he's in trouble. Well, why? Because it can cause gas gangrene, which is rapidly progressive and becomes a danger to life and limb. Again, I don't think this option fully explains the symptoms, because why would he get this in the first place? Why the red eyes or the seizure? Maybe it's a sign that his immune system is so on board with this that it said good night. Would definitely want to check his immunoglobulins, white cells and neutrophils at this point. Otherwise, the lead poisoning honestly feels like such a perfect diagnosis here, and the team still haven't mentioned a tox screen, so let's get more clues.
Clostridium's in dirt and basically harmless.
It has to be some other environmental toxin. Nothing else fits.
Trichinosis from eating infected meat.
Start treatment for trichinosis. Confirm with a muscle biopsy.
Sam, she wants to get to know you better.
You're asking me to condone a relationship based on lies and mistrust. When and where?
Miles said he'd stop by later.
Oh, tell him not to. I don't want to be seen like this.
And you want me to leave?
No, don't.
It's a guy thing. They don't like showing weakness in front of each other. Do you mind waiting outside for this?
Thought you were gonna tell her.
She's waiting for you to. If you want to be king, sometimes you have to be willing to take what's yours.
It's just dinner. Relax. What could he possibly do?
Sorry we're late. This is Sarah.
It's nice to meet you.
His muscle biopsy's clean. It's not trichinosis.
Fungal infection.
You want to retest every sample we took for spores? We'll be here all night.
He's not going to accept this isn't environmental unless we give him no choice.
I cannot believe you're from Bloomington. Remember that strip club?
I used to work at that strip club.
Of course, House is messing around with escorts when the Grim Reaper looks to be escorting our patient out of the building. They showed his legs there and it looked like the muscle bulk was falling off them with the skin creases, so what could this be? No, he didn't skip leg day. He's likely gotten a condition called rhabdomyolysis, which can cause kidney failure as a result of prolonged pressure on the muscle. It would be incredibly unlikely to happen in this situation when a patient is just lying in hospital, but definitely not unheard of. Usually it's caused by people beginning to exercise suddenly, like going from 0 to full David Goggins, and then realizing that their ambition is greater than their conditioning. For us though, it means a new clue. Well, Foreman and 13 think that the house is going to think the patient has a missed fungal infection, which is why they're testing every sample for spores, although it's unlikely to change things. They don't actually think it's fungal, but have noticed House is in more pain than usual, which means he's off his A game. Why does that mean more tests? Well, it will take longer to try and convince him beyond reasonable doubt that this isn't a fungal infection. But what if it actually is? He has a fungal infection and a Clostridium infection and this allergy, and now his kidneys are failing and muscles are breaking down. Okay, I have a fantastic theory. The night before the event, the king gives the knights disgusting things to drink, right? Well, the king has realized that his soon-to-be wife is infatuated with Sir William, having control of the concoction to give him, and with William's trust in the knighthood, he knows that William can be poisoned without being detected. The poison stays in the system overnight, waiting until morning to strike, which is when it starts kicking in. So what is it? Well, with red eyes, the delayed action and the swinging heart rate, it could be caused by methanol, ethylene glycol, or even organophosphate poisoning. The muscle breakdown does fit with the menthol or ethylene glycol poisoning, which is basically antifreeze. All right, I'm going for antifreeze poisoning via jealous king as my third and final diagnostic guess. We are locked in.
Rhabdomyolysis means his kidneys are failing.
Which one of you checked out the apartment? He did. Search the apartment.
He hasn't been there in 3 weeks.
You and 13 check out his place. We'll ultrasound the liver.
House Smith, Sam.
He brought a transvestite prostitute to dinner. Am I out of my mind?
You never know what can happen.
Looks like you were right. Tumors. Dozens of them.
See that? That's definitely not cancer.
Kitchen's clean.
The most dangerous thing in his medicine cabinet was dental floss.
What the hell is this?
Our knight is a witch.
These tumors that aren't tumors, every time one explodes, they'd be releasing another dose.
Plumbum nigrum.
It's Latin for black lead.
Lead poisoning.
Biopsy the cysts. Finds your lead.
They think it's lead poisoning, but no epiphany moment. That means the big first prediction was nothing more than amateur magic. I know why House keeps beating me in these challenges now. I have a necromancy book deficiency. If I had that, then surely each house diagnosis would be like a walk in the park of ash. Fiery ash. It is definitely a big clue, as we know that there's something funky going on here. Could he have unusual exposure to sheep or cow's blood? Or maybe it's still CJD, but he got exposure through his rituals rather than the king's challenges. That would be untreatable though, so makes it a poor diagnosis. The team have also mentioned tooth-related things a few times now, come to think of it. Chase said the most dangerous thing in the cabinet was dental floss, and Foreman mentioned that the king should get dental plans for the knights. Why? Seems like a misplaced statement unless it was relevant. Maybe his lack of tooth hygiene holds the secret for what toxins he's been accumulating in these liver cysts. Taub thinks it's something slowly building up in the liver and that these blood cysts have been allowing them to be released in short bursts as they rupture. Now, of course, this wouldn't happen in the way that we saw in the scan because ruptured cysts don't just have blood that just disappears. It needs to go somewhere. But how could teeth be involved? I mean, if he's really committed to going full night, then maybe he doesn't have any fresh fruit or vegetables, which means he could be deficient of vitamin C. Scurvy. That could explain the bad teeth, red eyes, and seizures, but not really the variable heart rates or muscle breakdown. Maybe that's because of all the adrenaline that they've treated him with and that he's actually allergic to, or the excessively long stay in hospital without moving much. It could work and would fit, but I'm out of diagnostic guesses, so let's see what it actually is.
You think we'll make the 7:30?
I'm sorry, if I don't change, I'm gonna feel like I'm at work all night. Is it a problem?
Well, there's always the 9:40. Or not.
Shouldn't you be at the hospital?
Wouldn't need a team if I did all the work now, would I? What I did the other night was juvenile. I'm sorry.
Souffle was amazing.
It's my mom's recipe.
I need to go to the bathroom. Is it safe to leave the two of you?
Come on, James, enough already.
You're a cold-hearted bitch who ripped his heart out.
And all this?
Phase 2 of getting to know my enemy.
You're wrong about me.
Pin scene.
Well, it's too late for the movie. Want to see what's on TV?
Absolutely.
There wasn't any lead present in his blood work or liver biopsy.
And his heart rate and BP are getting even more erratic.
There's only one thing left to do.
We're wasting our time. We looked everywhere, tested everything.
You spell that?
Yeah, it's the apothecary shop. I cry your pardon, sir.
You know what this is?
Well, that's lavender.
Try rose hips.
My uncle owns the shop. I just started apprenticing. What's the big deal? I just organized all that.
You know what this is?
A wild carrot?
It's hemlock, you embossed carbuncle. Did you sell it to anyone?
It was just one branch. To the king.
Because you poisoned him. If it was for the challenge, why is Wee Willie the only knight who's dying? You now know what's wrong with you.
It's not true. It's the best night I've ever known.
Something's wrong. But he's getting worse, not better. He may have had some hemlock, but it's not what's killing him.
Now they're talking. This is a house episode. I know I predicted it was the king that poisoned him because of the wife jealousy, stealing your queen kind of situation, but it doesn't seem that is the case. The king gave hemlock to all the knights as he thought it was a wild carrot. So there was something about William that made him respond the way he did. So what is that thing, the unifying factor that explains it all? I mean, in all fairness, nutritional deficiency, scurvy situation would still explain his sensitivity, considering his body would already be fighting to maintain normality and is much easier thrown out of balance than that of the less dedicated knights. He could also be taking a medication that reduces the body's ability to metabolize the hemlock, which causes it to build up more. There would usually be antibiotics, short-term alcohol use, or even some HIV medications. Oh, that would be a mad one. Could his necromancy rituals be an effort to cleanse his blood? Maybe he doesn't have as much faith in the old ways as he thought though, and he's still taking his prescribed meds. I mean, that would explain everything and also be a crazy surprise here at the end. But then so would scurvy, and HIV wouldn't quite explain the constant dental references. House is definitely getting in the episode spirit as well, as he went absolutely medieval on Sam. How will that turn out? I kind of respect her response. He was a charging bear and she stood her ground. He didn't back off, but she's kept all her limbs ready for the forest trek that will be dating Wilson. All right, I'm itching to find out what happens.
You got a minute?
I have a sword.
We were married young. We both made mistakes. I did make most of them, but that was almost a decade ago. But we do have one thing in common. We care about James.
We did it. These aren't focal hepatic lesions on his liver. They're pileosis hepatis lesions.
Infection on his heart valve.
Anabolic steroid abuse. Ancient poison accelerated the damage of the modern poison.
You don't need to win anyone's heart. You just need to ask for it.
She deserves the best. Guess I'd rather she be happy even if it means I'm not.
You really are an idiot.
Anabolic steroids! It's more common than we think. Around 4% of regular gym goers actually use some kind of gear, but presumably their gym isn't an actual battlefield. Steroids mixed with the hemlock is what did it to him. I thought some kind of other drug could be involved that would make him susceptible, but definitely didn't think anabolics. House got it from the weird liver cysts, which can be caused by it, but also by a ton of other things like immunosuppressants or toxins like arsenic. I have to concede to House on that one. Great call. I love this episode. 8.2 out of 10 entertainment, 8 out of 10 accuracy, 8.3 out of 10 diagnosis. This episode doesn't make full sense until you watch the previous one where the whole hospital gets locked down.